Have you ever felt unusually tired, noticed swelling around your ankles, or seen changes in how often you urinate? Sometimes, these subtle changes may be linked to kidney health. Your kidneys work quietly in the background every single day, helping keep your body balanced and functioning properly. In this video, we'll explore what the kidneys do, what certain symptoms may mean, the difference between kidney disease and kidney failure, common risk factors, and supportive habits that may help maintain kidney health. What do the kidneys actually do? Most people have two kidneys located near the middle of the back, just below the rib cage. Each kidney is about the size of a fist, and contains millions of tiny filtering units called nephrons. These nephrons help filter waste products and excess fluid from the blood, which eventually leave the body through urine. But the kidneys do much more than that. They also help balance fluids and electrolytes like sodium and potassium, support healthy blood pressure regulation, help produce hormones involved in red blood cell production, activate vitamin D, which supports bone health. Because the kidneys affect multiple systems in the body, changes in kidney function can sometimes impact overall wellness over time. How healthcare professionals check kidney function. Kidney health is usually evaluated using blood tests, urine tests, and sometimes imaging scans. One commonly used blood test is called eGFR, or estimated glomerular filtration rate. This helps estimate how well the kidneys are filtering waste from the blood. Another common test measures creatinine, a waste product that can build up if kidney function changes. Urine tests may also check for albumin or protein in the urine, since this can sometimes signal changes in kidney filtering. In some situations, healthcare professionals may recommend imaging tests like ultrasound to better understand kidney structure and function. These results are usually interpreted over time, since trends can provide more useful information than a single test alone. Acute kidney injury versus chronic kidney disease. You may hear terms like acute kidney injury or chronic kidney disease, often shortened to AKI and CKD. Acute kidney injury refers to a sudden decline in kidney function. In some cases, kidney function may improve once the underlying issue is addressed. Chronic kidney disease, on the other hand, develops gradually over time, and may slowly reduce kidney function over the years. Kidney failure, sometimes called end-stage kidney disease, means the kidneys are no longer able to filter enough waste and fluid to fully support the body without additional medical treatment. Treatment approaches vary depending on the individual situation, and should always be discussed with qualified healthcare professionals. Common causes and risk factors. Several conditions may increase the risk of kidney disease. Some of the most common include diabetes, high blood pressure, certain infections, long-term use of some medications, inherited or genetic conditions. Risk may also increase with older age, family history, cardiovascular conditions, certain lifestyle factors. One challenge is that kidney disease can sometimes develop quietly without obvious symptoms in the early stages. That's one reason regular health checkups may be important, especially for people with known risk factors. Possible signs and symptoms. Early signs linked to kidney concerns may include ongoing fatigue, swelling in the feet, ankles or around the eyes, changes in urination frequency, foamy urine, difficulty concentrating, reduced appetite. However, these symptoms can also be associated with many other conditions. If you notice persistent or concerning changes, it's important to speak with a qualified healthcare professional for proper evaluation. Why early detection matters. Early detection may help healthcare professionals identify changes before complications become more serious. Monitoring kidney-related markers like eGFR and urine albumin over time can provide a clearer picture of kidney health and help guide future care decisions. For some individuals, early monitoring may support conversations about lifestyle habits, medications, or other supportive approaches. Supportive lifestyle habits. While treatment plans vary from person to person, some general wellness habits may help support kidney health. These may include eating balanced meals, managing sodium intake appropriately, staying hydrated without over-consuming fluids, supporting healthy blood pressure levels, staying physically active, attending regular medical checkups. Some healthcare professionals also recommend being mindful with long-term use of certain medications like NSAIDs unless medically advised. Before making significant lifestyle or dietary changes, it's best to consult a qualified healthcare professional. What happens if kidney function declines? If kidney function becomes significantly reduced, healthcare professionals may discuss additional treatment options. Depending on the situation, this may include medications to help manage blood pressure or fluid balance dialysis, kidney transplant evaluation. These decisions are highly individualized and depend on a person's overall health, medical history, and laboratory findings. Questions to discuss with a healthcare professional. If you're concerned about kidney health, you may consider asking about eGFR testing, urine albumin testing, blood pressure monitoring, medication reviews, personal risk factors. Keeping a simple health log may also help track symptoms, blood pressure readings, or changes over time. Reliable educational resources. For evidence-based kidney health information, many people look to organizations such as the National Kidney Foundation, local renal associations, hospital education centers, public health services. Support groups and patient communities may also provide practical guidance for individuals navigating dialysis or transplant discussions. Emotional and mental health side of kidney conditions. Living with long-term health concerns can sometimes affect emotional wellness too. Some individuals managing kidney disease may experience stress, uncertainty, frustration, or emotional fatigue, especially when adjusting to lifestyle changes, medical appointments, or ongoing treatments. That's why emotional support can be just as important as physical care. Many healthcare teams encourage patients to speak openly about mental and emotional well-being during appointments. Counseling services, patient education programs, and support communities may help some people feel more informed and less isolated during their health journey. Family members and caregivers also play an important role. Having supportive conversations and learning together can sometimes make medical decisions feel less overwhelming. Everyday habits that may support kidney wellness. While no single habit can guarantee prevention of kidney disease, some everyday choices may help support overall kidney function and general wellness over time. For many people, healthcare professionals encourage maintaining balanced blood pressure levels, supporting healthy blood sugar management, staying physically active, getting enough sleep, attending regular health screenings, avoiding smoking, following medication instructions carefully. Hydration is another commonly discussed topic. Water helps support many body functions, including fluid balance. However, hydration needs can vary depending on a person's health condition, activity level, climate, and medical guidance. More water is not always better for every individual, especially for those with certain kidney or heart conditions. That's why personalized medical advice is important. Understanding dialysis. When kidney function becomes severely reduced, some individuals may require dialysis. Dialysis is a medical treatment that helps remove waste products and extra fluid from the blood when the kidneys can no longer perform these functions effectively. There are different types of dialysis, but the two most commonly discussed are hemodialysis, peritoneal dialysis. Hemodialysis usually involves filtering blood through a machine at a treatment center, or sometimes at home under medical supervision. Peritoneal dialysis uses the lining of the abdomen to help filter waste through a special cleansing fluid. Treatment plans vary greatly from person to person, and healthcare professionals work closely with patients to determine appropriate options based on individual needs. Kidney transplant awareness. For some people with advanced kidney disease, a kidney transplant may become a treatment option. A transplant involves surgically placing a healthy kidney from a donor into the body. Donors may be living donors or deceased donors, depending on medical compatibility and transplant availability. Transplant evaluation often includes multiple medical assessments to determine whether the procedure may be suitable and safe for the individual. After transplantation, ongoing medical monitoring remains important, and patients are typically prescribed medications to help support the body's acceptance of the new kidney. Why routine checkups matter. One important thing to remember is that kidney disease may develop slowly and quietly over time. Some people may not notice symptoms until kidney function has already changed significantly. Routine health screenings may help identify certain changes earlier, especially for individuals with FA, diabetes, high blood pressure, family history of kidney disease, cardiovascular concerns. Healthcare professionals may recommend periodic blood tests, urine testing, or blood pressure monitoring depending on personal risk factors. Even small changes identified early may help guide supportive care discussions sooner rather than later. Final reminder: learning about kidney health doesn't mean assuming something is wrong. Educational content like this is meant to help increase awareness and encourage informed conversations with qualified healthcare professionals. If you notice persistent symptoms, have existing health conditions, or simply want to better understand your risk factors, speaking with a licensed clinician can help provide personalized guidance based on your individual situation. Thank you for watching and taking time to learn more about kidney health and overall wellness. This content is for educational and informational purposes only, and is not medical advice. Always consult a qualified healthcare professional regarding symptoms, medications or treatment.